Hello guys, now we are going to talk about the amyloidosis. Actually, it is the deposition of amyloids in extracellular spaces due to some clinical conditions in organs and tissues. So we are going to discuss about the classification of the amyloidosis. So it is classified in two types, that is systemic amyloidosis and localized amyloidosis. So in case of localized amyloidosis, these are actually boundaried, matlab, these are separated to a specific organ. So like lung, larynx, skin, tongue or urinary bladder. In case of systemic amyloidosis, we can see it is divided into two types. One is primary amyloidosis or secondary, another is secondary systemic amyloidosis. So in the example of primary amyloidosis is the multiple myeloma, that is AL type amyloid, that is amyloid light chain type amyloid. And in case of secondary amyloidosis, it is due to neoplasmic states, and this is AA type, and there is another type, that is the hereditary or senile type. In case of senile cerebral amyloidosis, we can see A beta type amyloids, which leads to the Alzheimer's disease. The beta amyloid plaques and neuronal tangles are seen, which are the main clinical features of Alzheimer's disease. These are the beta amyloid plaques is due to amyloidosis, and it happens when a normal enzyme is distorted to another abnormal enzyme, that is the alpha secretase is the normal enzyme which is replaced by beta secretase in case of Alzheimer's disease. It causes small fragments synthesis of the beta amyloids, and they stick together to form beta amyloid plaques. This leads to Alzheimer's disease. This is the clinical importance. Then another clinical importance is in case of chronic renal failure, there is long-term hemodialysis is done. Actually, long-term hemodialysis is done. So in that case, beta 2 microglobulins are frequently seen. There is another type that is known as isolated atrial amyloidosis. That is another type. Now we have to know about the pathogenesis of amyloidosis. So how the primary amyloidosis is formed in body, precipitated in our body, we have to know. So if there is increased light chain production of immunoglobulins and decreased metabolism of them, then there is chance of primary amyloidosis. And if also there is increased transthyretin, then also the primary amyloidosis can precipitate. And in case of secondary amyloidosis, if there is long-term inflammation or tissue damage, then increased secretion of cytokines leads to stimulation of liver for synthesis of SAA, that is serum associated amyloids. Sorry, that is the wrong I have said. It is the serum amyloid associates, and which is the precursor protein for amyloid associates. So it leads to increase in amyloid associates and then leads to the secondary amyloidosis. So in this process, interleukin 6 and interleukin 1 is also associated. There is increase in all of them. Interleukin 6 and interleukin 1, both of them are increased in case of secondary amyloidosis. Now we have to know what are the staining characteristics of amyloids. There are two types of staining. One is routine staining, that is done by hematoxylin and eosin, and another is a special staining which is done with the Congo red or crystal violet. So let's see what is the routine staining. In routine staining, the result is extracellular eosinophilic amyloids. That means the amyloids become pink and they remain extracellular. So in the special staining, we can see if we use Congo red, it takes orange red under light microscope, the amyloids, and if we see by polarizing microscope, we can see apple green birefringence in case of polarizing microscope. This is very important. And if we use crystal violet then and use distilled water as mounting media, we can see there is metachromatic staining. Okay, the metachromatic staining means differential staining, matlab different staining. The crystal violet itself is a violet stain, but when it is staining the amyloids, the amyloids becomes red stain. So the color is changed. These all staining characteristics are due to the beta pleated sheath appearance of the amyloids. Now, the primary amyloidosis. In case of primary amyloidosis, the organs affected are skin, heart, GIT, gastrointestinal tract, and the peripheral nerves. And in case of secondary amyloidosis, the kidney, liver, spleen, tongue, and the lymph nodes are affected mainly. There are some macro features which are seen in case of amyloidosis. The organ size increases, and in case of cross section of the organ we can see firm waxy appearance of the organ. And now there is another staining characteristic. If we use Localized iodine plus 0.1 molar HCl in a tissue slice, and if it turns blue, that means there is presence of amyloids. Another staining characteristic is if we use iodine in tissue slice, it becomes yellow, and if we give H2SO4 in it, it becomes blue. This also indicates amyloidosis of the tissue slice. Now, if we want to specify the form of the amyloid, suppose which type of amyloid is this, then we have to do a special staining, that is immunohistochemical staining. In this staining, we use antibody tagged dyes. Like if we have to determine the AL type of amyloid, we will use a dye which is having or tagged with antibody which is specific for the AL. Then this will be stained the AL. If it is present, the staining will be there. Now we have to see the what are the changes in the organs and where these amyloids are deposited. So in case of kidney, if the amyloids are deposited, it is deposited in the glomerular vessels, and it leads to death actually. And in case of liver, if it is deposited, it deposits in the space of disc. And if it is deposited in the spleen, there is increased size of the spleen. And there are two types of spleen formation, the two types of conditions, like one is Sago Spleen and another is called the Localized spleen. The Sago Spleen is due to amyloid deposition in the white pulp, that is the splenic follicles of the spleen. It looks like there is tapioca like granules in the cross section, we can see. And in case of Localized spleen, there is involvement of red pulp and the sinuses in the spleen, that leads to the Localized spleen formation. In cross section we can see more big parts of amyloids depositions. The clinical symptoms associated with amyloidosis is depending upon the magnitude of the deposition, and they are non-specific actually, but there are some symptoms like weakness, syncope, weight loss. And in case of renal failure, there might be proteinuria, uremia. And in case of cardiac problems, there might be chronic cardiac failure. Then there might be arrhythmia due to amyloidosis. The diagnosis is basically done by biopsy. In case of localized amyloidosis, the organ biopsy is done, and in case of systemic amyloidosis, rectal or gingival biopsy is taken. And there is nowadays FNAC is also done from the abdominal fat aspirate.